Hey everyone! Today we are talking about a remarkable plant compound called berberine and a groundbreaking study that showed it can shift type 2 diabetes back to prediabetic levels. This research came from a landmark Chinese trial published in the Journal of Clinical Endocrinology and Metabolism. The study was led by endocrinologists from Shanghai Jiao Tong University School of Medicine, and it has changed how we view natural options for blood sugar control. The study involved 116 adults between the ages of 25 and 70. Everyone in the study had been recently diagnosed with type 2 diabetes. Their diabetes was still in the early stages, but they had already moved beyond prediabetes. None of them were taking medication, yet even though they qualified for it. The researchers divided these participants into two groups. One group took 2 placebo capsules every day for 3 months. The other group took 2 capsules containing berberine each day. Every capsule held 500 milligrams of berberine, so the total daily dose was 1 gram. Berberine used in this study was extracted from the roots of a plant called Coptes chinensis, which is also known as Chinese goldthread. This extract was at least 97% pure, and that level of purity is a critical detail. Many berberine supplements on the market today do not state their purity level, and some use much lower-grade extracts. If you want to replicate the results from this trial, you need to look for a supplement that verifies its extract purity. The results were striking. After 3 months, the berberine group saw their glucose levels drop from the diabetic range into the prediabetic range. This was not a minor reduction in blood sugar. The participants moved an entire clinical category, which points to a major increase in insulin sensitivity. Even more impressive was the effect on other health markers. Berberine lowered blood pressure, reduced interleukin-6 levels, and brought triglycerides into the normal healthy range. These improvements were actually stronger than the glucose effects, which shows that berberine offers broad metabolic benefits beyond just sugar control. This 2008 trial has been backed up by many follow-up studies. A 2022 systematic review published in Frontiers in Pharmacology confirmed that berberine has significant glucose-lowering effects. Size of the effect depends on your starting levels of fasting plasma glucose and HbA1c. A 2021 meta-analysis of randomized controlled trials found that berberine reduced HbA1c by an average of 0.73 percentage points. It also cut fasting blood glucose by 0.86 millimoles per liter and postprandial glucose by 1.26 millimoles per liter. Umbrella meta-analysis published in 2023 confirmed these numbers again, showing reductions in fasting blood glucose, HbA1c, and improvements in insulin resistance markers. These effect sizes are not marginal. A drop of 0.73 percentage points in HbA1c is clinically meaningful, and it is comparable to some prescription diabetes drugs. This matters for anyone managing blood sugar because it shows that berberine is not a weak intervention. It is a potent option, especially for people in the early stages of metabolic problems. So how does berberine actually work in the body? It activates an enzyme called AMPK, which is often referred to as the metabolic master switch. An AMPK turns on your cells become more sensitive to insulin, and glucose uptake increases. The liver also reduces its production of glucose. Berberine improves the gut microbiome too, which helps lower endoxemia and systemic inflammation. Many diabetes medications only target one pathway, but berberine works on multiple fronts at once. It tackles glucose metabolism, lipid profiles, blood pressure, and inflammatory markers simultaneously, and that multi-target action explains why its benefits go so far beyond blood sugar. Safety is a real consideration with any supplement. Berberine is generally well tolerated, but some studies report mild gastrointestinal side effects. It can interact with medications that are processed by the liver, so anyone already on diabetes drugs must talk to their doctor before adding berberine. The researchers in the Shanghai study also noted that long-term studies with larger groups are needed to confirm the findings, but the existing evidence across multiple meta-analyses is very strong. Cost is one of the most compelling reasons to consider berberine. At 1 gram per day, a month's supply of quality berberine costs between $10 and $20. Compare that to GLP-1 agonist medications, which can run $800 to $1,000 per month without insurance. Berberine is not a replacement for prescribed medication in every case, but it offers an affordable option for people with early-stage diabetes or metabolic syndrome who are not yet on pharmaceutical treatment. Berberine has a long history in traditional medicine. Healers used herbs containing berberine, along with cinnamon, black cumin, and ginger, to treat diabetes long before modern pharmaceuticals existed. Recent animal studies suggest berberine may even extend lifespan by up to 80%. Other natural compounds like rutin and propolis have shown similar antidiabetic effects, which supports the idea that plant-based interventions have real biological power. The researchers from the Shanghai study concluded that berberine may be used for patients with type 2 diabetes and metabolic syndrome, given its benefits on glucose lipids and blood pressure. The accumulated evidence from the 2008 trial, plus the 2022 Frontiers in Pharmacology, review the 2021 meta-analysis, and the 2023 Umbrella Review all point the same way. Berberine is a legitimate and powerful tool for early-stage type 2 diabetes. If you have early diabetes or metabolic syndrome, look for a high-purity berberine supplement and check with your healthcare provider about proper dosing and interactions. Thank you for watching, and I will see you next time.